that's right. It's Dr. Alex Earle, and it's Hump Day with Dr. Alex Earle. And this is the time I get to spend with you guys and answer all of your plastic surgery questions. You can ask about anything regarding plastic surgery from head to toe, from pre-op to post-op, and you know you're getting good information because I am a double board certified, Ivy League educated, and Duke trained plastic surgeon with over 12 years of experience and thousands of cases under my belt. And as you all know, today I want to talk about what I was doing down in Bogota, Colombia. That's right. So many of you know last week I did the live, and then I went directly to the airport, hopped on a plane, and went to Bogota. And what I did there was I went there to refine and get the latest techniques on this new procedure that's taking basically the world by storm. But certainly it's fresh and new here in the U.S. And only very few surgeons are actually doing it here in the U.S. because very few have gotten the adequate training to do this in a very safe way. And what I'm talking about here is the rib remodel procedure. That's right, where we are actually changing the shape of the ribs in order to create a smaller waist, okay? And so I want to go into this once again, but before I do that, I just want to show you guys that are just logging on. So this is it, guys. I have my certificate right here, so you can see that. So that's me, Dr. Alex Earle. Steve is my first name for you guys who don't know. And so I am now completely certified in this procedure, which is called the B-waist or rib remodel procedure, and it's signed by one of the top surgeons here in the world, Dr. Hoyos, who was the program director. So now I have done just about everything that needs to be done to make sure that you are the best and safest surgeon doing this procedure. So prior to this, I had done a cadaver course, quite a few months back, and then I've gone to see several cases from some of my colleagues, and then I've done a couple cases, and then I kind of took it to the very end with this course down in Colombia as well. So now, super comfortable with the procedure, and like I said, not a lot of surgeons are doing this in the U.S., but I certainly am, and honestly, I've got some of the best training and the best experience with this in the entire U.S., okay? So, rib remodel. First of all, what are the different names for it, all right? Because a lot of people have seen different names. Some people, rib remodel is kind of like the catch-all phrase. But then there's some other names for it. Some people call it B-waist, which stands for Barbie waist. Other people call it the wasp waist because the waist is small like a wasp. I've heard people call it rib sculpt, and I've heard people call it rib X scar by one of the other surgeons who teaches this procedure, and so they call it the rib X scar procedure as well. Okay, and so these are different names for the same thing. But what I want you to understand, like truly deeply understand, is what it's not. And it is not rib removal. Okay? So that is what it is not. It is not rib removal. Okay? Because whenever I talk about this, there's always, the what do you call them? The screen warriors and Instagram and TikTok, and then I go, oh my God, doctor, I can't believe you're doing that. Removing ribs, it's you're taking away the body's protection for their vital organs, and it's so dangerous, and this and that. And then and then I get back to them, I'm like, hey, that's not what I'm doing. Hello, can you actually look at what I'm doing? All right, before you start sending all these messages and sending all these questions, which are irrelevant, because that's not what we're doing. We're not removing ribs, okay? All the ribs remain inside your body, okay? We got that? All right, so it's not rib removal, it is rib remodel or rib sculpting. We are changing the shape of the rib so that we can bring the ribs in to create a smaller waist, okay? And so the way that we're doing it now, and the reason why this is taken off right now, is because technology has advanced to the point where we can do this with minimal to no scarring, because it's all done through a tiny 18-gauge needle hole. It's all done through a needle hole. Have you ever poked yourself with a needle? For whatever reason, to draw blood or to do an injection, things like that. Like a vaccine, right? So, and you know what? It leaves no scar, right? Okay? So yes, we're doing this through an 18-gauge needle hole, basically a scarless technique, okay? And so why we can do that, because we have a specialized device called the piezotome, which is a device that has a tip to it which looks like an 18-gauge needle, and that tip is used to make a very controlled fracture of the rib. And so the rib, if you look at a rib from the side view, a rib kind of looks like this, okay? If you're looking at it from the side view. And so it has two cortices, two areas to it. It has the upper cortex, which is up here, and it has the lower cortex, which is down there, okay? Now, if you're in a car crash, for example, and you fracture a rib, you typically you crash and you fracture both cortex, the upper and the lower. That's an uncontrolled fracture. What we're doing with this special device, is we're doing a very controlled fracture that only does a fracture in the upper cortex of the rib. So the lower cortex of the rib remains intact. Okay? So it's what's called a green stick fracture. So we're able to do a green stick fracture through the upper cortex of the rib only. So it's very, very controlled, and what that does is that, imagine this is the rib, okay? What that does is that it allows you to bend the rib, okay? So you guys see that? So look at the markers. So it allows you to bend the rib, okay? So what we're doing is we're essentially bending the rib through a controlled fracture of the outer cortex of the rib. So it's a controlled green stick fracture, so we can bend the rib. And so when you bend something, it makes the angle smaller. And so when you have a smaller angle, you have a smaller waist. Okay? So that's what we're doing. So we're bending ribs, we're not removing ribs. And we're doing it through a tiny, tiny hole that's virtually scarless. All right? And so then the next question is, well, can you do all ribs? And like, no, certainly no. So what makes this safe? Well, it makes it safe because we're only addressing the ribs that are the lowest risk, which are the lower ribs. All right, so we only address the lower ribs, which are often called the floating ribs. Okay, and that's ribs 10, 11, and 12. 10, 11, and 12. All right, so you want to stick to only those ribs, because if you start going higher, then of course the risk goes up, and we want to keep this as safe as possible. All right, so you're doing only the 3 lower ribs, 10, 11, and 12. In some patients, they may not have a 12. You know, so what we do is that before doing the procedure, we can get a CAT scan. So we're going to get a CT scan of the chest, okay? In that CT scan of the chest, we're going to get what's called a 3D rib recon, okay? So you get a CT scan of the chest with a 3D rib reconstruction, and that way we can do some preoperative planning, and we can make sure that the patient has all 3 of these ribs. Some patients are missing the 12th rib, sometimes they're missing on one side versus the other, etc., etc. Okay? So we do the preoperative planning, we identify the ribs we're going to treat. We're only going to treat the floating ribs. And why are these low-risk ribs? Why? First of all, they're not in the lung space, they're lower than that. Okay? Second of all, they don't have what's called a neurovascular bundle, or at least the bundle is not completely attached to the rib, right? So 11 and 12 usually do not have a neurovascular bundle attached to them at all. 10 may or may not have it, and so that's another reason to get the CT scan beforehand to determine whether it has it or not. And if it does have it, then we can stay away from 10 as well. All right? So, but typically they don't have a neurovascular bundle, so that means that there's no artery, vein, and nerve associated with it. So what does that do? It makes it very, very safe, and I put an asterisk there, okay, and I'll tell you why in a second. But it also makes it so that there's minimal pain, because if there's no nerve associated with it, then there's no nerve to irritate to cause pain. And so when we do these procedures, and we can combine it typically with liposculpture and BBL, the patients have the regular pain from liposculpture and BBL, but they don't have much additional pain associated with the rib remodel procedure. Okay? So minimal pain. And of course, it's a great procedure because it now allows us to create a very natural result without having to overexpand the hips, for example, or overexpand the buttocks. So definitely no ant booties here, no diaper booties, no hips that don't have anything to do with the patient's frame, because we don't have to expand the hips so much now, because we can still get that great waist to hip ratio by making the waist smaller without having to overdo the hips. So you can get beautiful, beautiful enhanced natural results. This works great for thin patients. It works who probably don't have a lot of fat to work with in the first place. It works great for thin patients, lower BMI patients, athletic patients. This is a great procedure for the athletic patients as well. And so basically, it's just the new latest frontier of the BBL. This kind of just takes the BBL to the next level. Like all the people out there that before thought they could never get that ideal waist to hip ratio because they don't have enough fat, or they're too athletic or things of that nature, now they can finally achieve this with this procedure. All right? But what's the caveat, right? Not everything's not always good. There's not always upside, okay? Actually, two caveats. One, for the patient. Well, it is a commitment. You have to wear a corset, basically 23 hours a day, so 23/7 times 3 months. Okay? And it's a must do. No negotiation. Okay? If you cannot commit to wear a corset 23 hours a day for 3 months, do not do the procedure. Do not do it. Okay? Because you're not going to get the result you want. The ribs may not heal adequately, and things of that nature. Okay? So, it is a must do commitment, corset for 3 months. Okay? And what's the other thing? Why did I put an asterisk here? Why did I put an asterisk here under safe? Because it can be very, very safe if it's done by the right surgeon, who's got the right training, who's got the right experience, who's got the right technology and technique to do this procedure, and they're doing it in a, in a certified clinic, ideally higher than just the Department of Health, but a clinic that's certified, for example, by the Joint Commission, like we are here at Pure Plastic Surgery. So, you have to go, like anything else in life, right? You have to go to the right surgeon. And I'm happy to say that we're one of the very few surgeons here in Miami that has all of the training and experience required for this procedure. Okay? All right. Let's open it up for questions.
Plenty of questions here.
Yeah.
Instead of a CT scan, can you get an MRI?
No, unfortunately the MRI does not produce the same types of images as the CT scan in terms of reconstructing that bony structure, okay? So really the best exam is the CT scan. Plus, the CT scan is going to be a lot cheaper than MRI. So it's a lot more cost effective.
Will you fix the fracture with screws or just the corset will help fix the rib?
So you think of it like a cast, right? So there's a couple ways to fix the fracture. You can do hardware, or you can use a cast. And so the corset is the cast way of fixing the fracture, right? So that's why, like I mentioned before, it is a must do. You have to commit corset 3 months. If you can't commit, don't do the procedure.
Is it mandatory to stay at a recovery house after a BBL?
It is not mandatory to stay at a recovery house. You can stay at a hotel or Airbnb. There's different options. You can bring your own caregiver. In fact, you should bring your own caregiver. But on top of that, sometimes you can add additional nursing type services. And if you want us to help you with that, we can do that here at Pure. So all of our patients, we give you the option. We are affiliated with a hotel. We are affiliated with a post-op care service. And we can get all of that organized for you.
Let's see. All right, we're going to go to some TikTok questions quick.
All right.
Can I still get a BBL in my buttock area if I have implants?
Okay, so with ultrasound imaging, which is what we do here, then the answer to that question is actually yes. Because the ultrasound, you can actually see where the implant is, but more importantly, where the implant is not, so that you don't injure the implant. Okay, so if you have buttock implants, but you still require maybe softening, making it a little smoother, or perhaps a little bigger, or a little bit more volume, then you can do fat transfer, but just make sure you go to someone who uses the ultrasound, okay, so that they can see exactly where that implant is, make sure they don't injure the implant.
What happens if you get pregnant after a few years pertaining to the rib remodel?
So, that's a good question. So, what happens after this, after your ribs are fully healed, nothing happens. You can get pregnant, it's not a problem. But why did this procedure kind of come about in the first place? And you mentioned pregnancy. So sometimes, what happens when you get pregnant and you carry the baby for 9 months is that it does actually alter the shape of your body. It actually alters the ribs, and so it alters some of the bones in your body. The pelvis tends to get wider, and the lower rib cage tends to get wider after pregnancy. And that's typically something that then doesn't bounce back after you have the baby. So a lot of women have noticed this. Like after they become pregnant once or twice or multiple times, they've noticed that their ribs and their waist has just flared out. And even though they're no longer pregnant and they're working out and they're eating and they're super healthy, super nutritious in the gym, the waist is still not getting as small as it used to be when they were like 18 or whatever, before they were ever pregnant, because the ribs have flared out due to the pregnancy. And so that's something that we can correct with this procedure.
Can you just do the rib remodeling without lipo and BBL?
You can, yes, you can. So you can certainly do that, and that I would say would be for like patients that maybe already had lipo or BBL, because if you really want to get the best result, you kind of combine it all, right? If you really want to go into that curvy shape, if you really want to shrink the waist as much as possible, then it's typically best to also do some lipo to help aid shrink the waist, right? So you can shrink it in both directions. You can shrink it with reducing the amount of fat in the waist area, and then also in bringing in or resculpting the ribs, bringing in the angle of the ribs. So so the answer is yes, you can do it, but typically for the best results, you do combine it with liposculpture and BBL.
Should I fix an anterior pelvic tilt before surgery, or does it not matter?
No, it's not going to matter. And sometimes it's very, very challenging to fix that. So typically you're okay. You can move forward, whether you have an anterior pelvic tilt, whether you have a certain degree of scoliosis, as well.
Can you increase the hip size with your BBL?
Yes, that's one of the points of the BBL, right? Is to increase the hip size, okay? Or to fill in a hip dip. I get so much pushback for this. All the personal trainers out there, and also the people that think they know. I put up a sign saying that exercise won't fix a hip dip, and it won't, because there's no muscle in the hip dip area, right? What does exercise do? Exercise, of course, is good for your health, your heart health, but exercise, if you're doing weights, it helps build muscle, right? What becomes bigger? The muscles become bigger, right? So if you're thinking about the gluteal muscle, then yes, you can build a gluteal muscle, and that's going to give you projection towards the back. But there's no muscle in the hip dip area, okay? And therefore, there's no way to build it out. In fact, if you really get into the gym and you do a lot of cardio, you do a lot of work, and you lose body fat, the hip dips become more noticeable. They become worse, okay? So the only way to fill in a hip dip is by putting in a filler, and the best filler is your own fat. So yes, you can certainly fill in a hip dip with a BBL, and you can certainly make the hips wider with a BBL.
When you mentioned corset, what type of corset? Like a waist trainer?
It looks very similar to a waist trainer, yeah. So initially, we typically use the corsets that have like the multiple clips, so that you can start, bringing in the clips as you move along. Like every day, you want to bring in another clip, another clip, another clip. And a lot of times you start off with a corset that's like about medium size, and then you may go to small, and eventually you may even go to extra small. All right. And as you're moving along, sometimes maybe after 6 weeks, you can even then start applying one of those corsets that has the strings in the back. If you really want to crank it down, okay? So yeah, there's a lot of options there, but keep in mind, the type, you kind of have a little bit of control as to how small you want your waist to be, right? To a certain degree, of course. You can't take it all the way down. But at the same time, if you don't want to look unnatural, like if you don't want to look like cartoonish or anything like that, then make sure that you're not doing the corset too tight, right? You don't want to go overboard either, right? So in that sense, when you start wearing the corset, you got to think about, what is the final look that I want, right? Because you don't want to overdo it.
If your ribs are already inverted, but you want a smaller waist, what would you suggest? If the ribs are already as small as they can be, then the next step is liposuction, right? That's all you can do. Or sometimes if, say maybe the reason why the waist is not so small because you have muscle weakness or muscle separation from pregnancy. And so sometimes what's required is a tummy tuck, and when we go ahead and do that, on the inside we do what's called like an internal corset, right? We bring the muscles together, we strengthen the muscles, we cinch them in at the waist level, and that can also help bring in the waist. All right, so three ways to bring in the waist. 1, tummy tuck with internal corset muscle plication. 2, liposculpture. 3, rib remodel. Okay?
Mm-hmm. Is it true that you can remove up to 3 ribs instead of the fracture to have the same effect?
We're not removing ribs. Okay? I am not recommending removing ribs. Do not remove ribs. Okay? That's what turns a super safe, minimal to no scarring procedure into a big scarring, much less safe procedure. Okay? So while removing ribs, it will create a dramatic effect. I am not recommending that, and that's not what we do. Okay? Once again, I want to be super clear about this. We are not removing ribs. We are remodeling them. We're sculpting them, if you want to call it. You want to call it rib sculpt. You want to call it rib remodel. Barbie waist. All these names are fine, but it's not rib removal.
Can patients who've had health issues before, like Forex, cancer, or heart problems, still get a BBL?
That's going to depend very much on your current medical condition and whether you are healthy and whether you're able to get the clearances that you need. Okay? So that's going to be very much on an individual kind of one-to-one basis. So I can't tell. You may be a candidate, you may not be. It depends on your current medical conditions, what medications you're on, how your labs and all your studies come out, whether you get cleared or not. So there's a lot of ifs to that question.
How long does one have to wait for a BBL lipo following VSG?
Okay, a gastric bypass or gastric sleeve. So you want to wait. So the short answer is usually about 6 months. But what's the more detailed answer? The more detailed answer is once you've hit a plateau in your weight, meaning that your weight is number one, kind of your ideal weight where you want to be long term, and that you're able to maintain that weight for at least a few months. Okay? Because when you get your gastric sleeve, right, you typically what happens is boom, you start losing a ton of weight, right? So you don't want to do surgery in that down curve when you're losing weight. And then you hit a low point, and then you kind of bounce back a little bit. And so you don't want to do surgery at the low point, and you don't want to do surgery when you're bouncing back a little bit. You want it when it's a straight line. Like I guess I'm like doing it in the air, nobody can see. You're gonna lose weight, you're gonna bounce back a little bit, and then you're gonna plateau. So you want to do it in the plateau phase. That's when you want to do surgery, which for most people is around 6 months.
Thank you. We have a comment here. Can you show us more mini tummy tucks on your page? Tummy tuck pics.
Sure, I can certainly do that, but the reason you don't see a lot of mini tummy tucks is because very few patients actually qualify for a mini tummy tuck, okay? And let me explain that. What is a mini tummy tuck? A mini tummy tuck doesn't just mean smaller scar or shorter scar. It means that we're not doing a lot of the things that come with a full tummy tuck, which means we're not putting a scar around the belly button because the belly button's not moving, and we're also not doing the muscle plication or muscle repair. Okay, so all you're doing with a mini tummy tuck is simply removing a little bit of excess skin below the belly button. And you're doing it through an incision that may be shorter than a full tummy tuck, but it's not a short incision. It's still longer than your typical C-section scar. Okay? So, for the most part, patients that have lost weight or have gone through pregnancy, they're candidates for a full tummy tuck and not a mini tummy tuck.
What can be done to lower CMP?
To lower CMP?
I'm not sure what that is. I was hoping you would know.
CMP typically stands for complete metabolic profile, but that's multiple electrolytes that are on there, your potassium, your sodium, your chloride, etc. So it's not just one thing, unless I'm not understanding the question correctly.
Yes, send a follow-up if we're not talking about that, please. How long will the fat in the hip dips last? Is it permanent since there's no muscle there?
So once the fat, settles, it's gonna last forever, for the rest of your life. So what I mean with once the fat settles. So you do lose some fat initially, right? So you typically lose about 30% of the fat that's initially placed, all right? For the most part, for most patients. Some patients may lose up to 40%, okay? But the remainder, that 60-70% that remains with you forever. So yes, you certainly can permanently fix a hip dip.
Thank you very much. What's the biggest implant you can do?
So the biggest implant I can do is the biggest implant they sell from the manufacturer, and so that is of 800 cc's. That's as big as you can go.
Have you ever used BBL implants?
So I don't do buttock implants myself. It's not a procedure that I do. Like I said, everything that I do at Pure Plastic Surgery is because I've done a lot of it, and because I've done a lot of training and a lot of studying and research and everything else, and because I consider myself an expert in it. Okay? Because your safety is always my number one priority. And if it's not any of those above, then I don't do it. And so for that's, you know, and that's where butt implants come in. Excuse me. I don't have a lot of experience doing butt implants. It's not a procedure that I do, and therefore I don't offer it. I understand that there's some patients that don't, you know, really qualify for BBL because they have little to no fat and require a buttock implant. And so, you know, for those patients, I recommend, you know, some of my colleagues that do that procedure.
What are major long-term health risks for the rib remodel, if any?
So there are none. There are none. Again, remember, we're not removing the ribs, so we're not removing any sort of like protection for the organs. We're not removing any sort of, you know, excursion of the lungs. We're not removing anything. We're simply reshaping them, okay? So once those ribs heal after those 3 months in the corset, there is no long-term consequence to that, okay, once they heal. But you need to make sure that they heal. And so the way to make sure that they heal is to make sure that you're in your cast, which is your corset, for the 3 months. Once again, super important.
When is the best time for a BBL if you are on GLP-1 medication, currently on maintenance dose?
Okay, so if you're on GLP-1s, you're on maintenance dose, the best time is whenever you want. You're good to go, because I am assuming that you're on maintenance and your weight is now stable, right? Again, we want stable weight. So if you have a stable weight, then that's a good time to do it. Now, just keep in mind that you're going to have to stop the GLP-1 medication 30 days before surgery. You can restart it after surgery, but for 30 days before surgery, you have to stop it.
Why is the fat in BBLs hard and not soft like natural booties?
I'm not sure why you're saying that. I think most of the BBL booties are soft, natural, kind of shaking, wiggling type of booties. So I would say actually the overwhelming majority of them are. Now, there is a thing that's called fat necrosis, and that's when the fat is injected, it neither survives nor gets absorbed, and so it becomes like a hard kind of clump or scar tissue, and that can sometimes happen, but it's not the majority. It's very much the minority. Typically happens maybe 1 to 2% of the time.
All right, for the serious question here is,
okay.
I'm coming to you for a rib remodel in a few months.
Yes, all right.
When can I have sex following this procedure?
Great question. So when the answer is going to be at 6 weeks. Okay, so 6 weeks post-op you can have sex, but here's the caveat. That's what makes it a little funny, maybe, I don't know. You have to have sex with your corset on. Okay, that's the deal. If you want to have sex before the 3 months, so between 6 weeks and 3 months, you can do it, but the corset needs to stay on. Okay, so don't go buck wild with that one.
All right, well, now we have more questions on that. Same question for BBL and tummy tuck.
Right, same answer, 6 weeks. So 6 weeks for tummy tuck, 6 weeks for BBL, 6 weeks for most major kind of body procedures.
All right, and we're at 30 minutes already, so maybe that's a good place to end this at.
Okay,
so,
that was actually a great question. A lot of people are wondering, right? And so yeah, that's the only caveat. You can have sex at the 6 weeks, but the corset, it must stay on. Okay? All right, everybody. Well, once again, here it is. This is the proof. The proof is in the pudding, right? The proof is there. So one of the highest trained rib remodel surgeons here, certainly in Miami, certainly in Florida, and in the entire U.S. Okay. So if you're researching this procedure, now you know where to go. Okay. All right. Well, I look forward to seeing you all next week on Hump Day with Dr. Alex Earle. Take care, everybody. Ciao.